Hey guys, so today I'm going to address a common complaint for people who come in and get a massage. Usually they will talk about the area between the scapula, and so the rhomboids are the big muscles there that we want to target. But the other common problem that can happen is that people can't or don't want to, for whatever reason, lie face down. So today I'm going to talk about how to work on the rhomboids and this area between the scapula with your client supine. So as I warm up the tissue, you'll notice that I'm sliding my hands underneath their back, and I really want to get my fingertips on the medial border of the scapula so that I'm sinking into those rhomboid attachments, and then I'm taking my other hand and pressing down into their shoulder and creating a nice dual pressure. So I've got the table underneath my fingertips allowing me to push up into the rhomboids, and then using my body weight to sink down, really creating a good awareness of the shoulder and a good awareness of what's going on with this area of their back. As I squeeze the shoulder, I'm not only compressing into the rhomboids and the pecs, but I'm also creating space in the shoulder and palpating for the source of what's going on in the rhomboids. Right around where the rhomboids insert into the scapula is a common holding place for trigger points, and oftentimes they will shoot out to the deltoids, but sometimes those trigger points shoot right through to the front into the pecs. And so what I like to do here is press both of those spots that my client feels that trigger point, starting in the rhomboids and ending right through underneath the clavicle. And as I hold those 2 points, I press deeply and I ask my client to take a big deep breath. Creating awareness to what your client is feeling can often be the trick to helping them let go and helping that pain release. So using visual cues here can be a huge addition to your work. I'm holding my hands up here to demonstrate how I hold my hands underneath my client's scapula, using my right thumb to hold the superior angle, left thumb to hold the inferior angle, and my fingers to hold the medial border. I wish I had a glass table with a camera underneath to show you the actual work I'm doing, but I'll do my best to describe it. I'm using my left hand here to hold onto the scapula, and what that does is stabilizes it so that it doesn't move around and allows me to use my right hand to do the work in the rhomboids. So as I slide up the rhomboids, I'm actually following the medial border of the scapula along to the superior angle and hitting all of those attachment sites and allowing the stability of my left hand to give my right hand the freedom to move. Once I've done that, I want to move the entire scapula around and give the rhomboids awareness of the space I've just created. Again here, I'm showing you what my hands are doing underneath my client's back to create a wave. So follow the rhythm of the pull and then the push with my fingers and then my thumbs. I'm going to repeat this underneath my client's scapula. This fancy little wave move may seem superfluous, but you're actually passively moving the scapula along the rib cage, giving it some freedom of movement that it really needs. When working the scapula in the supine position, I definitely want to play around with passive movement of my client's arm. So here, as I pull her arm up and then lay it across her body, it pulls the scapula away from the spine, elongating those rhomboids, and then with slight pressure and movement on that arm, I can manipulate what the scapula does, and as I sink into the rhomboids, can either shorten or lengthen those muscles depending on what I feel like needs to be done in that moment. One technique that I love in this position is as I pull her arm across, it lengthens those rhomboids. I sink in with my hand that's on the table, and then pulling the arm back, it softens that muscle right onto my finger. So I repeat this a few times, lengthening, pressing, and then softening, and that can really help to ease a lot of tension. I think one of the best things about this position is that every degree that I move the arm either up or down or diagonally across or lifting it up away from the table is another different angle that I'm able to sink into every fiber of the rhomboids. So with each little move, I'm hitting a different part of that muscle. Engaging the rhomboids a little more actively, I'm going to have my client hold their arm up and make sure it stays lifted. And as I sink underneath their scapula, I can really feel how much the scapula influences the arm. It's slid pretty far away from their spine at this point, so I want to make sure that I'm really sinking into the rhomboids. And as I do, I'm going to have them punch their fist up towards the ceiling so it lifts their whole shoulder away from the table. This really engages all of the muscles around the shoulder and lengthens the rhomboids at the same time. So when my client relaxes her shoulder back down to the table, it's a combination of awareness of holding up those muscles while letting the rhomboids relax at the same time, which is a whole new complexity and a whole new awareness to what those muscles do specifically. So as she pushes up and then relaxes back down, I'm isolating the rhomboids and working on them as they soften into a deeper state of relaxing. If you guys have already watched my video on the traps and my video on the rotator cuff series, very specifically on the one about the subscapularis, you've seen me do this move and I love it. From the opposite side of the table, I pull my client's arm toward me and remind them to keep their body heavy, and then I reach around and I can work on all of these lengthened muscles on the back from a whole different angle with a whole different pressure. I think one of the most important things to know about this technique is that your client has got to really let their body be heavy in your hands. If they don't and they're holding on, it's not really going to work and you're not really going to have the effect you want. So using my left hand here to keep their shoulder down away from their ear, and my right hand to define the scapula, the medial border down to the inferior angle, I can move the whole scapula around, and as I move it, sink into each of those rhomboid fibers, so repeatedly creating a pull and a compression, a pull and a compression. This is also a really great time to remind your client of the connection between their shoulder and their neck. So as much as we are targeting the rhomboids here, this is a great position to slide all the way up into the neck. And I often find that this is one of those moves that makes clients kind of go, oh my gosh, I've never had my neck open up like this before. And that is so powerful, both for them and for you. With the rhomboids nice and loose here, take your palms and push down into the lateral border and into the superior angle, and give the rhomboids some passive movement and give the rhomboids some nice fluidity from this position. The last thing I like to do with anybody who's suffering with chronic tension and knots up in this area, which is almost everybody really, is to give them a little homework, to teach them how to release their own knots in their shoulders and their back. So I use a massage ball here. This is a yoga tune-up ball, but you can use a lacrosse ball or a tennis ball. And what I do is lift their arm up and I place the ball underneath their scapula, actually kind of medial, so into the rhomboids. And I then move their arm around and show them how to move their own arm so that the rhomboid lengthens and then softens, and then the scapula can sink back towards the table or push away from the spine. And all of these different angles and all of these different motions can create different openings for different knots. And that's the key to really releasing this really tight muscle. Thanks for watching as always, and I hope some of this helps. I hope you guys get some good pointers, but what not to do? Don't ever drop your camera on your client. It's not recommended. It doesn't help anybody. Thanks.